Hello, I'm Dr. Mike. Otitis externa, or ear infection, is a common problem in both dogs and cats. In fact, many pets suffer from mild chronic infections that may not be noticed by an owner until a veterinarian examines the ear. For a brief introduction into otitis externa, we're going to meet with Dr. Amy Parker from Rancho Santa Margarita, California.
Otitis externa is simply the inflammation of the external ear canal. Ear infections and inflammation in dogs and cats can be due to allergies, and those can be environmental allergies or food allergies. And sometimes in cats mainly it can be due to parasites like ear mites. In dogs they can also have hormonal imbalances like hypothyroidism, autoimmune diseases. Every once in a while we may find tumors or polyps that are leading to inflammation and infection in the ear canal. Also, just daily environmental things that they do, like swimming. Water can get into the ear canal and cause inflammation. Hair growth in the canal can do it also. Sometimes we also find that if we're cleaning too much, then that can cause inflammation too. Some breeds are predisposed to ear infections, especially the floppy-eared breeds like Cocker Spaniels, some Retrievers also. Some breeds can have narrowed ear canals, Shar-Peis, Chows, and those narrowing and the floppy ears lead to that inflammation, and infection can build up and cause worsening. Clinical signs of otitis externa or inflammation of the ear could simply be reddening of the ear canal, pus, wax, or debris, and even odor coming from the ear, head shaking, scratching, rubbing, and even abnormal behavior. We may also notice hearing loss. First thing with diagnosing ear infections is physical exam, looking for the redness and wax overgrowth in the ear. We may also do a swab where we take sample from the ear and put it on a slide and look under a microscope and look for organisms such as yeast and bacteria, along with mites if we think that's present. Additionally, we may take a culture from the ear and send that to the lab, and they'll culture that bacteria and see what antibiotic it's susceptible to, so we know that treatment that we're giving them is correct. Treatment of otitis externa could be either medical or surgical. Medical treatment may include flushing and cleaning the ears, topical antibiotic or antifungal treatment, along with anti-inflammatory corticosteroids to decrease that inflammation. Or if the ears are bad enough, then surgery may be indicated. If you notice any of these clinical signs that you may think that your dog has ear infection, seeing a veterinarian as soon as possible is important for treatment, not only to relieve the pain and infection in the ear, but to also prevent any future complications with ear infections.
Dr. Parker mentioned several factors that may lead to ear infections. Understanding that the anatomy of the ear canal, especially in certain breeds of dogs with large floppy ears, actually creates the perfect environment for bacteria and yeast. Getting water in the ear or a foreign body can also be predisposing factors. One of the most common causes of ear infections in pets is an allergy. This may be an allergy to something in your pet's food or something in the environment. I recommend that you ask your veterinarian what tests need to be performed to determine the cause of the infection. The earlier the problem is identified, the more effective our treatment will be, and the less likely that the problem will become chronic.